denominator. There is a common denominator with all patients with temporomandibular joint disease. After doing several thousand, I've probably done 2,000 temporomandibular joint surgeries, whether they be open joint surgeries, where you actually see the joint visually with eyes, or through a scope, which we call closed joint surgeries. There was one thing that I always noted during those surgeries, and that is that there was inflammation in the joint. And that actually is the common denominator with joint problems. The real cause of temporomandibular joint disease is inflammation. Now, it seems too simple. We all know the word. If we watch TV, you all hear about inflammation. But the point is that science has missed the point that if you start out with the point of view that inflammation is the common denominator cause, then you can work backwards and relate the inflammation within the joint to each and every one of those symptoms. Now, what's inflammation? Inflammation is a very simple concept within science, a little basic science on inflammation. Inflammation is composed of 5 characteristics. You know, doctors have to speak in Latin to sound important, so instead of saying redness, increased temperature, swelling, and pain and dysfunction, we have to say rubor, calor, tumor, dolor, and functionalacia, which means redness, increased temperature, tumor, swelling, pain, and dysfunction. That's basically what inflammation is. And inflammation is the body's response to any kind of damage. I don't care where it is. A good example is when you cut yourself in the kitchen. If you cut yourself with a kitchen knife, put your Band-Aid on it. In the morning, when you take the Band-Aid off, you're going to see 2 red lines on either side of that cut. Well, those red lines are actually inflammation. And inflammation is the body's response to healing. And that's what inflammation is. It's the body's first response to healing. And it has these characteristics. So anybody that had a boil or a fracture or a bee sting, you're going to see these characteristics. But what it really is more scientifically, and we're not going to spend a lot of time looking at big words here, but it's a cascade of cellular and exudative components, including all of these things, which is like a bunch of dominoes. Each domino hits the next, hits the next, hits the next, hits the next. And it ends up with a lot of activities, but it ends up with one of these guys called a macrophage. A macrophage is a cell that's specifically needed to remove damaged tissue. It's like the Pac-Man within the body. So if you have damaged tissue and inflammation is started, it's going to cascade domino to domino to domino to bring macrophages into the area. And the macrophage, like a Pac-Man, is going to eat away all the bad or damaged tissue. That's why inflammation in a joint, in any joint, is going to cause damage. What kind of damage? All kind of damage. It will eat away, first of all, it'll eat away the cushion. If left long enough, it'll eat away the bone. I've been inside many joints where the cushion is gone, and the bone is halfway degenerated or halfway gone. So basically, to understand where we're going with this, you need to just have an idea what inflammation is and what happens when anything is inflamed, especially inflammation in the temporomandibular joint.